People, the moment our feet hit the floor, sleep is something we crave.
Yeah, doctors say fewer and fewer people are getting enough sleep, and it could be affecting your health in more ways than we thought. RTV6's Jade Hindman explains.
With the demands of work, life, and play, many people live by the motto, sleep when you're dead. But doctors say eternal rest may come sooner than expected if sleep isn't a priority. It's a lesson one woman learned after her own brush with death.
Here at IU Health, this is a sleep lab where measurements are done in hours slept, oxygen levels, and heart rate. Diane Kane is a sleep lab patient.
I would wake up and just be tired still. I was a surgery nurse, and so I was working call hours and additional hours during the day shift even.
Diane says she was a busy, sleep-deprived mom working long overnight hours while taking care of her family. She was doing it all until one day it all stopped.
My blood pressure was very, very high, and I didn't feel bad, and so then I ended up having a massive stroke at 35 years old.
Today, the left side of her body is paralyzed. A sleep study helped determine Diane wasn't getting the hours of sleep she needed. Sleep apnea was partly to blame.
It's where I stopped breathing off and on throughout the night during my sleep, which keeps you from getting restful sleep.
Could we have prevented her stroke in the end? It's hard to know, but I think it's something where we need to be aware that sleep disorders is very important.
Dr. Ninotchka Sigwa is a sleep medicine doctor at IU Health. She says when it comes to overall health, sleep is just as important as an apple a day.
Or individuals who are chronically sleep deprived, they're at a higher risk for obesity. There's data showing that there's higher risk for high blood pressure, heart disease, diabetes, or poor sugar control is also related to chronic sleep deprivation.
Even depression and anxiety are symptoms of chronic sleep deprivation, and people with heart disease or high blood pressure like Diane pay an even higher price with their health when it comes to foregoing sleep.
So patients perform poorly, poor function, functional status, and overall increased risk for death for patients who are chronically sleep deprived.
So how much sleep should people be getting? Well, Dr. Sigwa says it's recommended adults get 7 to 9 hours of sleep, and teens need more with 8.5 to 9.5 hours of sleep. Shockingly, though, Dr. Sigwa says about 1/3 of the population is sleep deprived.
I think sleep is really underdiagnosed, and as individuals, we need to bring up our sleep issues with our doctors, because for Diane, at a very young age, she had issues with high blood pressure, obesity, and a stroke.
Diane says she's getting better rest these days. Every night, she uses a CPAP ventilator to help her get the hours of shut-eye she needs to live a longer life.
Yeah, I'm just happier. I'm rested.
Doctors say if you have trouble waking up or find yourself sleepy throughout the day, you may be sleep deprived and should talk to your doctor about ways to improve your shut-eye. Jade Hindman, RTV6.
Dr. Sigwa says it's also a good idea to turn off all those electronics when you head to bed. That means put away that cell phone and turn off the computer.